32 years old, you know, my kids are little kids. So the scariest part is kind of unknowing, and that's kind of where you hear me talk about I went under a blanket and I started falling into a hole, and I felt like I couldn't get out. And it's hard. It's hard because aside from the breast, what the cancer does to you during your treatment part of it, you know, it's the hair loss, it's the weight gain, it's the not feeling good, the lack of energy, and you really do, you get bloated and you're on these steroids and then you're nauseous, but then you're not losing. It's everything that goes along with the fact that not only do you not have a breast or hair, your whole body is different. It's hard when you look in the mirror to see past that.
And how does that make you feel, having them both removed?
You no longer feel sexy or attractive. You feel like you're mutilated and someone literally chopped off your breast, you know, and I know it was for a good reason and I know it had to go, but when you look down and you see that, you think, wow, someone really just took it out. They just cut it out, you know. It's a strange, kind of a bittersweet where you're glad it's gone, but then you think, wow, I can't believe that was done to me. You know, I never, ever, ever imagined that would happen to me.
I want to say, it's like, I want to be so careful not to minimize how that must feel, because I personally would be terrified and devastated.
Yeah. I think I'm stronger than I ever knew.
Yes.
I think I have more faith than I believed I had.
Yes.
And I think there's a bigger purpose to me than the right now.
You know what? You think you have more strength than you ever knew? Take a look at what your family had to say.
When I see Anais, I see my sister as I've always known her. Cancer or not, she's still the same beautiful person. What I love most about Anais is that she's so caring and she's an amazing mother. She's definitely stronger than I ever imagined. This goes above and beyond what I thought she was capable of. She's been a great role model to so many thousands of women who've been reading her blog, and we're all so proud of her.
How does that make you feel?
I feel good.
All right, so after this, we have to go to a quick break, but I'm gonna have Dr. Orton and Dr. Lisa join us when we come back to go through all of your options and answer any questions that you have.
Okay.
All right?
Okay.
All right. I would love.
They said with the gene, it's recommended that they remove the other breast as well as the ovaries. Now, I'm wondering why not just do a full hysterectomy at that point?
فريقي مرة مجتهد. الكل يتدرب ساعات طويلة في كل الظروف. الكل يدرس بجد الخطط اللي حطها بنفسي.
جديد المراعي انفاجرو اي بلس مع نظام التغذية الثلاثي يحتوي على الفيتامينات ومدعم بمستويات عالية من الDHA والألياف. التغذية الجيدة تدعم طفلك لينشأ ذكيا ومتمتعا بالصحة.
عشان نفوز لازم نتمتع بالذكاء والصحة.
جديد المراعي انفاجرو اي بلس.
Wow, I've become one shade fairer. Let's see yours.
Mine is clearer.
We both started from the same number. So how did you move ahead? Did you cheat?
If you want double the result, then you need to apply Fair & Lovely daily.
Fair & Lovely clears marks, even skin tone, and gives up to 2 times clear fairness.
Wow, unbelievable.
Just apply it daily and no cheating.
Get clear fairness with Fair & Lovely.
هربت وراحت لعند عزيز.
أنا ما بقدر أثق فيك.
أتى زمن الصحوة.
هلا فيك تمشي. ليك السيارة قدام الباب.
وسنواجه أخطاءنا. وستفضح أعيننا.
عمر أنا ماني مرتب.
ما وارته قلوبنا.
أنا ما بحبك واضطريت أتجوزك غصبا عني، عم تفهم؟
ما عم يتذكر شيء من اللي صار معه.
وسيشهد غدنا.
كتب كل شيء بتذكره من زمان.
على ما أخفاه ماضينا.
أنت هلا مع الرجال اللي قتل جوزك.
عمر!
هذا الوجه أنا بتذكره منيح.
الزهرة البيضاء الليلة 8 KSA على MBC4.
مهما حميت المهم تخلي راسك بارد.
ببدأ بتمريرة وهمية، خليه يواجه الشمس واستغل الفرصة حتى اهجم.
هيدن شولدرز بالنعناع ببرد راسك، بخليه 100% بدون قشري. خلي راسك بارد مع هيدن شولدرز بالنعناع 100% بدون قشري.
برأيي المرأة لازم ما تتنازل، وخاصة في الأيام الصعبة. الآن ما عاد في داعي تختاري بين الراحة والحماية. أوز الماسية الجديدة تجمع بين حماية سطح النسيجات ونعومة السطح القطني عشان تكون السطح ميلانج الفريد من نوعه. حماية وراحة مع بعض عمرها ما صارت. جوهرتي الصغيرة، لا تنازل بس مع أوز الماسية.
The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
My niece is here with us today, and she's sharing her story about one of the scariest things that women can face. And of course, Dr. Orden and Dr. Lisa are out here to answer any questions you have.
Right.
You know, and Jillian, you're so right, because this really is one of the biggest medical issues that all women face. 12% of women in their lifetime may develop breast cancer. That means 1 out of 8 people.
And 1 in 8 just means that every one of us is touched by it. And you know that my mother passed away from breast cancer, so I've dealt with it personally as well as a physician. And it is, you know, it's emotional, it's a psychological thing, it deals with our femininity, and then dealing with the surgery, it's hard recovering post-operatively, and it's just
Lisa,
hard as a woman.
That's so true, because it's both emotional and physical. And in your case, you've already had a mastectomy, a modified radical mastectomy, and you're facing having another one, right? So I want to show you, and I want to show everybody out there what we're talking about. Now, today when we're treating breast cancer, we're doing what we call a modified radical mastectomy. What are we doing in this procedure? We're removing all of the breast tissue and typically some of the lymph nodes. How does your surgeon do it? He starts by making an incision essentially across the breast, and you're going to see that as part of this procedure, we have to take the nipple areolar complex with it, because it's been shown that if you take that with it, you have a higher chance of curing your breast cancer. You know, at that point, this tissue has then been removed. As you can see, we use cutting cautery. We carefully dissect this breast tissue off of the pectoralis major muscle, which is the deep bed in doing a mastectomy. Here you see the breast tissue being removed in total. The next thing your surgeon is going to want to evaluate is the status of your lymph nodes, because we know that breast cancer travels into the rest of your body, into your lymph nodes. And you may have heard the term a sentinel node lymph biopsy. So important. Dye is injected into the breast tissue. We can follow where that dye goes. It shows us which lymph nodes are most likely to contain cancer. Very important in staging and treating your breast cancer. So once that's been determined, your surgeon is going to remove those sentinel lymph nodes, send them for examination, and that's going to determine what's the best treatment in your case. Your surgeon closes the incision, he places a surgical drain. Typically that drain's going to be in for about a week. The cancer is gone, this breast is ready to be reconstructed. You know, and talking surgically, it may not be really something you want to talk about, but knowledge, understanding it a little bit better in those kind of terms, hopefully is going to give you more strength in dealing with it.
Right. And I had a question for you. You know, I'm going to have the right breast removed because I do carry the gene, the A2, or the BRCA2 gene. So the suggestion is they remove the other breast as well as the ovaries. Now, I've been told that when they remove the other breast, they may be able to do an implant right away. Have you
So
heard
you're
of?
talking about reconstruction. That's the next thing
Okay.
that I want to talk about. And
Okay.
that's so important for you. It's so important for every woman out there. So I want to take you through a little bit what we do with breast reconstruction. So let's assume this was your mastectomy here. Nowadays, what we do is probably the most straightforward method of breast reconstruction is putting in what we call a tissue expander. You place that below the skin. Over the course of 4 to 6 months, you're overinflating, stretching that skin. You want to overinflate it 40 to 60% more than the actual implant that you want. So how you do that, you inject saline into this through this portal. Over time, you've stretched the skin. You're now ready to put in a definitive breast implant. We place it inside below the muscle, like so. And in your case, Anise, we can reconstruct the side that you've already had your mastectomy and put in a tissue expander. That gives you a little bit of idea of how that works. The implant is placed below the muscle, and both sides can be done for you at the same time. Now, finally, your nipple areola is being removed also. That's a later stage procedure, but we can put back a nipple areola complex as well.
That's great to hear.
It's good to see you smile.
Yeah.
You see, there is hope.
We talked about, maybe taking your ovaries because of the positive gene.
Yeah, and that's a question I have for you. They said with the gene, it's recommended that they remove the other breast as well as the ovaries. Now, I'm wondering why not just do a full hysterectomy at that point? I mean,
And that's a really good question, because you do sometimes leave, because you can also, besides having increased risk of ovarian cancer, you can also have an increased risk of tubal cancers in your tubes as well. And if you only take the ovaries, sometimes there's a little bit of tube left.
Right.
So if you do the whole thing, you can you can totally remove it.
Okay.
This is all about restoring your quality of life.
Right.
Okay?
Okay.
Yeah, because we want you to have a fantastic long life with
your
family.
Feel good about yourself.
I want to thank you so much for sharing your story with us. And I just want to give you a quick opportunity. If there's anything you want to say to all the ladies here today and all the ladies watching at home.
I think just, if you feel something, get it checked out. It's not a death sentence. Just because they tell you you have cancer doesn't mean you're going to die. It just means you're going to change the way you live a little bit.
Thank you so much for being here with us today and telling your story. Up next, a family who spends thousands of hours together without talking. Why? Find out next.
For the next 48 hours, you will not be allowed to be connected to technology.
It's about 8 hours. They're running around the house. I have a splitting headache.